Consulting Partners. I'm the Orders, Beaker, and Willow Practice Director. I'm here today with Mallory Powers, one of our Beaker consultants. Mallory, go ahead and tell us a little bit about yourself.
As Lauren said, my name is Mallory Powers. I'm working in Beaker Consulting right now for Nordic. I've been in the Beaker realm for about 4 years. Worked at Epic, took a little bit of a break to work in Washington on some more policy side and meaningful use, and now I'm back doing Beaker Consulting.
Nice. One of the things that I was kind of thinking about as we were preparing for these sessions is operational engagement when it comes to doing an install in general. And I was curious about how operational engagement can affect a Beaker install.
I think operational engagement can make or break a Beaker install. Not including the right players in the beginning and making sure you have sign-off can make it so that your go live is either smooth or a disaster. And I say that because you may have someone on your team who knows their workflows, but if you don't make sure that the lab director or the lab manager or your supervisors know what's going on or feel like they've been part of the entire install, when they get to go live, they're going to be like, well, why is this done this way? This is not how we do things. Why didn't we get to say anything about this? Or I never had any idea this was coming. Or where did this go? Because I thought that this was done in validation. And there are shifts that happen throughout the install. Okay. So making sure that your lab directors and your managers and operational leadership know what's happening throughout the install, from validation through build, into testing, heavily into testing to see, as you're finding holes and things like that, what fixes are you putting in? And then really prepping them to say, what are your concern areas going into go live? What have you heard? That's a big one. What have you heard from other customers? Every Beaker customer has talked to another Beaker customer. Yeah. Making sure that they're feeling at ease, that they've voiced their concerns, that we can come up with ways to alleviate those concerns. That's a big piece of making sure your management is involved early on.
So what are some specific strategies that you've seen other customers deploy to successfully engage operational leadership?
One of them is making sure if you make changes in the install that your leadership is informed of every change that goes through. Not that it's just done on a VP level, but if the VPs make a change, that your director and your managers are feeling comfortable that that change is going to work for them. One of the things that I've seen that's been really successful is as you move through phase 4, through the testing phase, setting up weekly or bi-weekly meetings. Okay. Making sure that the team owns part of it and that the operational management team owns part of that meeting, so that both teams can bring to the table pieces that they want to tell each other, and that they're both on the same page about what's coming up with a Beaker install. I think that's been one area that making sure that there's that constant contact has really ensured that the users are more comfortable, and it's not just the IT department that feels they're ready for go live.
So you've specifically mentioned the lab managers and the lab directors. Are there other areas, nursing operational leadership or physician operational leadership, or other areas that you feel like you really need to make sure that those leaders are also engaged throughout the install in order to be successful?
It's not as much of an engagement, but ensuring that your nursing management knows exactly what that change will be if you are an add-on for Beaker, or what the workflows that their nurses will now be doing with Epic coming live. And I think that there is somewhat of a change. They're going to get new labels. There's new ways of ordering. They may see a shift in how orders looked before and how they look after go live. Okay. So making sure that nurses and then physicians know about any changes that are coming up to the system. And making sure that nurses are okay, that they understand what the workflow is and why it's set up in the way that it is, and that they can both work together, nursing and lab, to make sure they're giving proper patient care.
And that piece of communication, how have you seen that done effectively?
I think making sure everyone's in the room for validation is really important. And then when you're touching back on these points from validation, as you start to iron out your workflows, as you start to iron out your build, making sure that it's not just the lab that you're talking to, communicating with the nursing staff that, hey, this is coming up, we're going to sit down and talk to lab management. We'd like to make sure that there's a nurse manager or a unit manager or someone there to represent nursing so that we can ensure that everyone's on the same page.